Well, more than 6 million American couples are affected by infertility. And today's Helen Magazine segment, we're joined by Dr. Michelle Harrison from the Women's Clinic to answer a few questions about this often very private and personal struggle that many couples face. Thanks for being here this morning.
Thanks for having me.
Well, let's just start off and talk about really what defines infertility and sort of the couples who you see come in. What is it that actually defines infertility?
Infertility is when a couple is trying to get pregnant for over a year without success with not using any kind of contraception. See people come in and they've been working on that and not having any success. Workup would possibly be checking the male also. It's not always a female problem. Checking a semen analysis, then the woman might not be ovulating. She might be having regular periods, but there's always stuff to check out. You have to make sure that she's not having any uterine problems, ovarian problems. There's also hormones to check. Could be a thyroid issue. And once you've checked all of that, then you've got to figure out if she's not ovulating to try to put her on a hormone possibly to try to get her to ovulate. And sometimes you can also use a low dose of fertility medicine to try to get her to have regular cycles so that you can have success in the timing of intercourse in order to get a pregnancy.
Now, how long should couples wait if they aren't able to get pregnant? How long do you suggest they wait before they come in to see you?
In a younger couple, a year is fine, but if you're dealing with an older couple, older, not exactly older, but older in fertility issues, being mid-30s, probably don't wait that year. Come in more 6 months at the most, because age is definitely a factor in fertility. If women past 35 start to have decreased chance of getting pregnant, and then as you age further at 40, the egg quality is drastically decreased.
And you talking a little bit about the number, 6 million couples affected by infertility, and the number is rising. Why is that?
Well, a lot of women more today are working on their careers and getting that done before working on a family, and so family comes later in life these days.
And a lot of the fertility issues happen because as women age, it becomes harder to conceive.
Yes, it does.
And what are some things that couples can do when they come to see you? I mean, is it a matter of, you mentioned maybe going on a hormone, I mean, is there a lot that you can do at that point when couples come to see you?
Yeah, you have to do all the basic testing first. There are some simple tests to start with, like I was mentioning. Just it's not always the woman's fault. You got to do that semen analysis on the man, and then checking some hormone levels on the woman, and then you can start having the woman do something as simple as a basal body temperature chart, which is checking the temperature first thing in the morning before you even get out of bed, because even standing up can raise your temperature, and there should be a rise in the temperature at the mid-cycle if she's ovulating. Something as simple as checking ovulation kits over the counter to buy to check to see if she's ovulating. Those are some things that can be done, and also checking some hormones. You can also give her some a hormone to try to get her to have a withdrawal bleed, just to see if that she can have a period. If she's not even able to have a period after given a hormone, then you're dealing with a much bigger issue.
Right. Well, you're an important woman to a lot of couples, especially in this community. I really appreciate you being here this morning.
Thank you. Thanks for having me.
Well, coming up at 6:30, we'll take a look at this morning's top stories, including one Lafayette woman's life, how it was changed by